Welcome to Morning Grounds, Morning Rounds, Stony Brook Medicine's video series where leaders, faculty, and staff engage in candid conversations about key initiatives, institutional priorities, and expert insights on important topics shaping the future of healthcare. Today, in honor of Patient Experience Week, we're thrilled to be joined by Nicole Rossol, our Chief Patient Experience Officer here at Stony Brook Medicine. Nicole plays a leadership role in shaping the culture of care across our system, ensuring that every patient interaction is grounded in compassion, communication, and collaboration. We will be diving in to learn more about how meaningful, person-centered experience is essential as a component of high-quality clinical care, and how it is reflected in every part of our patient experience strategy. So, grab your coffee, settle in, and let's get started. Good morning, Nicole, and thank you so much for joining us today.
Good morning. I'm glad to be here, and thanks for having me.
It's a pleasure to have you. Maybe you can start by just sharing a little bit about the overall mission of the Patient Experience Department and everything that you're doing, and how that fits in with our overall strategic plan.
Sure. So patient experience, as you know, is so important, and it's something that we've really been focused on, and it's part of our strategy because we know that it's what matters most for patients and families. And so across Stony Brook Medicine, our goal is really to provide that high quality, safe, and compassionate experience. And we want to do that for all of our patients. And we know we can only do that if we have a very engaged team. So we have to really work very closely with our staff to make sure that they feel recognized and supported so that they can deliver this type of care. But when we do this, we also find that our patients have better overall outcomes. So how we care for them, how we make our patients feel, it's really important that we focus on that. And it's part of one of our main goals.
I think that's a really important thing that often people, I surmise, overlook, which is that when patients are more satisfied with their care, that also directly relates to better outcomes. What are some of the key sort of fundamental principles that you utilize in trying to improve the patient experience?
So one of the things that we really talk about and that we focus on is how we make our patients feel. And one of the things that we really looked at is having a consistent framework that all of our staff can kind of be a part of, that they can know, and that is part of our culture. And that's called compassionate connected care. It's our model that really helps us to operationalize how we care for our patients and those key behaviors that we focus on, so that we know that patients will hear us, that they're able to listen, that they're able to really collaborate with us, and together we can partner to improve the outcomes for them and their families.
That's great. I think we hear the phrase compassionate connected care a lot. So it's really helpful that you've given us a little bit of a definition. How do you, implement that in a clinical setting? And we have, of course, some busy clinical settings.
Yes. Well, the great thing about this model is that it actually doesn't take more time. It's really focused on that relationship that we're building between our staff and our patients. And so we want to have that foundation of trust. And so when we look to connect on something, it doesn't have to be something related to their health experience. It could be something, outside, something that they love to do. It helps to build that relationship. And so you look at the person beyond their diagnosis and really get to know them for who they are and also what matters most to them. And when we can build that sort of foundation, it tends to make that relationship that much better. And so when we're trying to maybe try a new medication, or there's specific things that we need to do in order to help our patients heal, it really helps to give them that sense of you have their back and that you're here to help and support them.
Right. I think when I was sort of going through my training, we didn't really hear very much about patient experience. Is this something that we should have been paying attention to before and we are paying attention to now? Or is this something that has come up as there's been more handoffs in the care of patients in the hospital. What do you think the drivers of that is?
I think it's been around in different iterations, through the years. I think we should be always focused more on it. And really, it's just about how we communicate with each other. And most of what we find is when we do have issues or concerns, it's based on communication. And so when we can really strengthen that relationship between our healthcare providers, both clinical and non-clinical staff, and our patients, and remove some of that friction, that it will actually help enhance the relationship. And, really helping people to understand how to communicate is not easy. Mm-hmm. We do it in our daily lives, but we all know sometimes we're better at it than others. And when you're stressed and you're anxious, it's hard to hear sometimes what people are saying. And sometimes it's just for us to listen to our patients and to really just be a supportive presence. Mm-hmm. It's not always us telling our patients what to do. We have to really listen to them so that we know that we're meeting their needs. So I think it's been something that's been really important, but we have to continue to focus on it. And it's evolved from really being kind of, a service component, to satisfaction. But when we think about it, that's really one-dimensional, right? When we look at satisfying a patient, which is why it's really patient experience. And now we're moving more to this human experience concept, because we know we need both our patients and our staff together to really create the best outcomes for our patients and families.
That's great. As you say, the communication is key. Mm-hmm. My kids are tired of hearing me say that no one ever dies from too much communication.
It's true.
But it's also very important what you said about when people are stressed or anxious, you may say things, but it may not register.
Yes.
And, I know that some of the studies that have looked at communication and what stays with a patient have looked in outpatient settings where people don't necessarily have the same anxiety level or stress level as they do in the inpatient setting. And of course, much of what we say doesn't register.
Right.
It just goes right by them. So it's so important to have multiple ways to be present for our patients.
Yes. So and I think too, how we make our patients feel, that's how they're making decisions. So that's why it's also important for us to really focus on it, because we want our patients to choose Stony Brook Medicine. We want them to be part of this healthcare organization, to get their care here, their families to get their care here. But often people are making those decisions based on how we make them feel. Right. So when we really focus on building these relationships, it creates that bond, which is really important for our patients and families.
Absolutely. So obviously this relies heavily on how we as hospital staff or in our ambulatory settings, our ambulatory staff relate to our patients. How do you make sure the staff are engaged? How do you make sure that their needs are met so that they can be as present as possible for their patients?
It's so important, and we can't do it otherwise. So one of the great things that we've done, especially using our compassionate connected care model, is also focused on what that means for staff. So it's a model not just for our patients, but it's also focused on what matters most to our staff. So leadership presence, for example, like we do our red sneaker rounds. And, these are really important components that we're present for our staff, that we're listening to our staff, that they have the support that they need to deliver the right care. So that's very important. And then I think really involving them in the care delivery. So when we've been doing this model, whether we're working with the hospitalists, our environment of care teams, working with nursing, it's all about helping them to co-design this with us. So we're doing it together. We're looking at what their scope of practice is like, what their day-to-day is like in terms of how they interact with patients, and then really applying these principles so that it resonates with them. And again, it's not about adding more to the plate of our teams. It's really about finding better, smarter, honestly, more efficient ways sometimes to show that compassion and demonstrate those important skills that they're building in terms of communicating with patients so that it makes their job better. It gives them more a sense of, joy in their work, we hope,
Right.
and also that recognition and gratitude from the patient. So we try to really connect the dots so that it's the patient and the provider or our staff together.
Right. It's a virtuous cycle, right?
Correct. Yes.
The better the staff and physicians and nurses are at providing compassionate, connected care, the more satisfied and happy the patients will be, and they will give that feedback, and it will create
Yes.
That's wonderful. Thank you.
Yeah.
I'm going to look down at my notes.
Sure.
Tell us a little bit about the iRound platform. What is that? It sounds like something we carry in our pockets or something.
Yes. So I know we refer to it a lot lately. And what we've done is really looked at how we can leverage technology to help us to provide kind of that point of contact with our patients in a proactive way. And so iRound is a platform that we use. It's actually something we can have on our phones or on the computer. We work with Press Ganey. It's a product that they have that helps us to look real time at how we're rounding on our patients and families. And we know that rounding has been around for a long, long time. Mm-hmm. But what we've done is really re-look at how we need to round in order to make it resonate with our patients. Often we'll hear, well, I didn't see anybody today from a patient. Mm-hmm. We know that we've had our staff in and out of the room, but it has to be a meaningful interaction.
Right.
It has to be something that, really matters to the patient. And so this platform helps us to see the patients that are on our units and to look at, key questions that we really want to focus on and to make sure that we get that data real time. So we can see, okay, we have X number of patients on this unit today, and maybe there's something going on that we can take care of right then and there. And that's an amazing thing because that's a type of suffering that they're having that we could take care of. Sometimes we can't alleviate all the suffering of our patients, even though we want to, but these are things that we can do. It's also about keeping our patients safe. So the more we're in the room, the more presence we have is less falls for our patients. It's making sure that we're meeting their needs, that we're managing their pain, and that we're creating this relationship with them. So we're doing this with nursing, with our environment of care teams, with our patient advocates, with our language access and our interpreter teams, so that we're really seeing what's happening in those moments. And then everyone has access to this platform. So you can see maybe some of the things that came up when I went in the room today. And then when you go in the room, you can also see what some of the other components are that they may have experienced that day. And so the goal is that we're working together as a team to care for our patients, to keep them safe, and make sure that they're getting that high quality, compassionate experience.
Has it been easy to get people to buy into using this new platform?
I think everything, there's time that it takes, right? But I will say as a culture, we really have been wanting something, again, that would be consistent, that we could all look at and use. And everyone wants the goal of making sure that we're able to meet our patients' needs. And when we can do it together, all looking at the same thing, I think that's been a really important selling point. And our nursing teams, our environment of care teams, again, they have been involved from day one in helping us to structure the content, to really practice and pilot some of this work on specific areas and units, and have helped to really roll it out to their colleagues. And I think that has been very powerful in terms of us getting buy-in from others. And the great news is that this will be across our system. So we'll have it at Southampton. We'll have it at Eastern Long Island Hospital. We're looking at some of potentially our ambulatory access as well for using this tool. So that will help us, again, to really provide that optimal experience across the continuum of care.
Great. I do want to switch gears a little bit. there are lots of ways we get input about how we're doing with patient experience. You mentioned Press Ganey, for example.
Yes.
There's HCAP scores, right?
Yep.
But we also have a patient and family advisory council. Tell us a little bit about that. How did it get started? What sorts of information do you get from it?
Great. So this is one of my favorite things to talk about because it's really about hearing our patient's voice. And if we don't listen to our patients, we can't improve and we can't reach our goals. It's absolutely essential that we really hear what our patients are saying. And so our Patient Family Advisory Council was started actually many years ago. And then it kind of took a little hiatus and we restarted it again in 2018. And the council is made up of past patients and family members who have had experiences in the hospital, in our outpatient settings, ambulatory settings, and they volunteer their time to meet with us on a monthly basis to talk about what matters to them, things that maybe went very well in their experiences, but also where there's some opportunities. And most of them live in our community. They care about Stony Brook Medicine. They want us to succeed. And they really are very, very devoted to doing what they can to give back to our organization. And so we've been meeting monthly since 2018, even during COVID.
Really?
We actually asked them if they wanted to take a pause, and they felt absolutely not, that they wanted more than ever to really be part of this healthcare team. And that's how we look at it. It's not a committee where, we're saying these are all the things as hospital leadership that need to get done. This is a true partnership where they're bringing ideas and thoughts, and we're really looking at what matters to them, how we can make some of those things happen. And what's exciting is that this past year, we actually launched our system Patient Family Advisory Council. So we have representation across all of our areas, which is fantastic. We've had our pediatric Patient Family Advisory Council that's been around for many years and is very active. And we also have our Cancer Center Patient Family Advisory Council. And so this group has been really as a whole so important to us. They've worked on specific projects like improving communication with physicians and nurses, for example. They worked with our healthcare team to redesign our communication boards that are hung in every single room of our hospitals. They also recently worked on a special video for family-activated and patient-activated rapid response. And so they became very interested in what that was. They learned more about it. We worked with our rapid response team, and they really participated in what that should look like. They also participate in things like our quality and patient safety committees. So they're part of our safety strategy. They're part of our patient education committee. So they're not just sitting in a room, or in a Zoom or Teams call. They're pretty active in what they do. And we're really excited for Patient Experience Week. They're going to be hosting an administrative grand rounds, and we're going to get to hear their stories.
That's great.
Yes.
Wow. Well, we owe them a big debt of gratitude for their willingness to volunteer their time and their wisdom to help our patient experience. And it's the level of commitment is really wonderful. Going forward, we talked about I-rounds a little bit, and I think, sometimes people think technology takes away from compassion or connectedness, but clearly you've been using technology to support it. Are there other ways that we are going to be using technology to help our patient experience?
It's a really good question because there's a lot of discussion right now with all of the AI work that we're doing and kind of looking at, does this take away from the experience for our patients and families? And I think, the answer is that we really have to kind of look at both, I think, and have a balance where we can have efficiencies for patients and families, where we can reduce those friction points, whether it's a text message or it's a way that we can communicate faster. We can get them the information they need. I think those are the things that we really want to focus on. That level of compassion that we have as a human interaction with one another, that I don't think we can replace, nor should we, because I think those pieces really, again, create what people want. They want to feel that connection. So I do think we need to look at a balance of using technology, which can be really helpful for us to advance how we're looking at experience for patients and families, but not lose those human connection points that we know are so essential for, our community and our patients and families.
That's great. That's great. Looking back at your time here as Chief Patient Experience Officer, what have been some of the particular successes that you're proud of, and what do you feel you want to achieve over the next, say, 5 years?
Oh, that's a big question.
Oh, yes. I like to ask big questions.
So, there have been so many moments. I have to say, I've really seen the evolution of our culture. And when we talk about our eye care values, when we talk about compassionate, connected care, those are things that all align together. And I feel that in our culture. I feel that when I come in the morning, when I'm walking through the lobby. Those are things that, I think we've really worked hard. And that's something that is palpable. There's still more, obviously, that we need to do, but I'm really proud of how we've worked as a team. The executive leadership support that we have for patient experience doesn't exist everywhere. We're very fortunate to have that, and it is a priority. And without that, it's very hard for us to, again, meet our goals and deliver the type of care that we know our patients deserve. So I'm very proud of kind of building that and helping really create a team and being part of that team to deliver this to our patients, because it is an honor and it's something that I take seriously and I care deeply about. So it's definitely something that's a passion of mine, and really continuing to grow that, I think, throughout our system so that no matter where our patients go, that's what they feel. I want that feeling for them. I want them to know that we're here for them, that we have their back, that we care about them. And yes, they're going to get the best possible care. But when we care for them first and really, again, look beyond their diagnosis, I think that's what really matters. And my goal is that we continue to do that and spread that. And that's what we're known for at Stony Brook Medicine. So we're on the journey, and I think we're continuing to see better outcomes and really connecting things like throughput and some of the other things that we're working so closely on to experience. Because you need to have those operational components and the compassionate, connected care to really create that optimal experience.
Right. I think it's important to take that system view and think that everything that we do, if whether it is a care outcome or something operational like throughput, and remember that it all affects our patients and it all gives them a different view of the experience, just as important as the communication part is.
It really is. And one thing that I'll say is that what really strikes me when I talk about culture is these moments that I see throughout our organization, and people don't know that I'm watching. So we had, for instance, a transporter recently, who was bringing out a mom with a new baby. And it's a beautiful moment. And I overheard them talking about the incredible relationship that they've had with their kids and what their experience was like, and really talking about, well, do you want to see my grandkids? This is a picture of them. And, and I think those are the things that you see that are those connections. One of our physicians I heard recently, just the way that she was speaking to this patient, and it was a really challenging situation, and the way that she was showing the care and compassion, and really helping to decrease the anxiety that this patient was having about an upcoming procedure. It was beautiful. And it was something that I think, again, those are the things that matter. Our nursing staff, I see often, the extra time they take. We had one of our patient advisors talk about one of our nursing assistants who braided her mom's hair when she was here so that, when she was leaving the hospital, she would feel, like she was feeling good about herself. So to me, it's those moments that shows me culturally kind of where we are. And it's happening all throughout Stony Brook Medicine.
That's wonderful. Wonderful. Well, thank you for your leadership.
Thank you.
I want to ask you one more question.
Sure.
You began your career in healthcare as a nurse, correct?
No, child life specialist.
Oh, child life
Yes,
specialist. Okay.
yes.
All right. So how did you end up moving towards patient experience?
Oh, it's a good question. And I love pediatrics. It's definitely a very special part of my heart. I think when you work in pediatrics, and I know our peds colleagues will agree, there's something really special about working with our pediatric patients and their families. And there are these intimate relationships that you're really able to kind of be witness to. And I saw really wonderful, wonderful interactions between physicians and nurses and, patient access staff and non-clinical team members, and what that did for our patients and families when I was in child life, and how I utilized those relationships to really help, do what I could to make that experience better. And so I really took kind of that piece and looked at the adult world and thought, I think we have some work to do, because just because you're an adult does not mean that you don't need that support. Mm-hmm. And in peds, there's a lot of support, like in child life, that we're able to do in other areas, where in the adult world, sometimes we lose a little bit of that. Right. And we shouldn't, because it doesn't matter what your age is, right? And so I think that applying those principles is really important to me. And so I started to learn a lot more. Patient experience was really growing at the time, where we had HCAPs starting. Mm-hmm. And so there was a lot more scrutiny in terms of what the metrics were for patient experience. I did a lot of work in patient advocacy and patient family-centered care, where, again, it's just applying these principles to anyone to make sure that we're providing that care and compassion with the clinical. And so for me, it's just been a journey where I've really felt everyone deserves it. And so, I want to continue to make sure that we build a system where we're operationalizing that, and it's happening for each and every patient we serve.
That's great. That's great. Well, thank you so much for your leadership. We are fortunate to have you here at Stony Brook Medicine. Your team's work is just vital to making sure our patients feel seen, heard, and cared for at every stage of their care. So thank you very much.
Thank you.
As always, thank you to everyone at Stony Brook Medicine for everything that you do to make a difference every day. So, until next time, keep the coffee brewing and innovation flowing at Stony Brook Medicine.